And we are continuing the conversation today. National Influenza Week runs from December 6th through the 12th in the city of Miami Gardens, actually nationwide. And this is really a time when, as a nation and as a community, we come together to encourage residents to get their influenza vaccine, to get their flu shot. And because COVID-19 is such a priority for us in the city of Miami Gardens, we're also including COVID education and vaccine opportunities in this week's activities. There's a plethora of things happening this week that we're going to tell you about a little bit later. But today, I want you to really lean in. We are about to have a conversation with a woman that's not only a clinician, she is an RN, case manager, but she has also been impacted by COVID-19 on a personal level. So today she is going to be sharing her story. Welcome to the show, Patricia.
Hi, Melissa. Thank you for having me.
Well, listen, thank you so much for agreeing to have the conversation. You know, your church is an amazing partner for Live Healthy Miami Gardens. So obviously, anytime I reach out to Father Ward from Holy Family and ask for participation, he always says yes.
Yes, he does. He's a great guy.
So, Patricia, tell me a little bit about your background. I know you're an RN, yes?
Yes, I'm a registered nurse with the state of Florida, and I worked in the Memorial Hospital system for 5 years when I first started my nursing career, which was about 16 years ago. And I'm now doing telephonic case management with workers' comp. Yeah.
Okay. Telephonic case management. What does that mean?
That means that I'm on the phone all day with patients or adjusters or doctors, nurses. That involves that. And workers' comp, when someone gets hurt on the job, a nurse comes onto their file possibly and talk to them, see how they're doing, follow up with their appointments, and just all around support for that worker.
Okay, so it sounds like it's a bit of a twofold thing. You support employers, but then you're also working with the patients when they're in the hospital, right? Do you ever have like a workers' comp patient that is impacted by COVID as well?
Yes, I have had a couple of patients that are hurt. They get injured on the job, but then they contract COVID and they end up in the hospital. And so it's like, what should I work on? Should I work on the injury that they have had from work or COVID? But of course, COVID will take the precedence because you want to get healthy. You want to get out of that hospital and go home to your family and then start again your treatment for your work comp injury.
So can you share what you're noticing, what you're experiencing from a professional level before we go on to your personal story?
Yes, well, I've noticed with the patients is that they feel very alone when they're in the hospital or if they have to quarantine, of course, from their family. So it really impacts them overall. And the patient could start getting depressed about it, and you're already hurt where you're in pain, and pain can also bring on depression, but then you have COVID, so it just impacts them all around.
So you are on the front lines as a case manager, working with workers' comp patients, some of whom also have COVID. And then my understanding is that you've also been personally impacted. Your family's been personally impacted by the pandemic as well.
Yes, we have. I had a favorite aunt. She was an amazing person, like a person that's regal. Like if you see a queen and you're just like, wow, in awe. I want to be with her. I want to talk to her, see what's in her mind. And last January, so we're coming up to 1 year, January 21st, where she had passed from COVID. and it was just so sudden. I know a lot of people go through what we went through, where it's just all of a sudden the person just passes away. Yeah, they're suffering from COVID, but they're going to get better. But no, it wasn't our case, and I miss my aunt so dearly.
I'm so sorry for your loss. So you said it's been about a year?
Yes, it'll be a year, January 21st, 1 year. And during the holidays, it's always when a family passes. Oh, it's my first holiday without her. And yes, we usually have a Christmas brunch, and she makes a sorrow, and she makes it the best. And so I think about that she won't be there. And she loved Christmas, and we're going to miss that for sure. It's going to impact us.
I can imagine. So was it a sudden situation with her with COVID, or did she have it for a long time and struggled with it like some people do?
Sudden. She got it, let's say, the Wednesday, and maybe she passed the Sunday, or she got it on the Sunday and then she passed the Wednesday. So it was very sudden, and
wow.
Yeah, it was fast.
Wow. I'm so sorry to hear that. Sometimes we hear stories about people who have it and then they end up in the hospital a couple of days later, and then after weeks.
Yeah. It wasn't like that for us. But I do have my sister-in-law whose father, that's what he went through. He was in Jamaica and he contracted COVID, and he was in the hospital for a week and a half, and then he passed away.
Oh, wow. So you have two family members who passed from COVID. Yeah, I'm really sorry to hear that. A good friend of mine who worked on my campaign, two of my team members I lost to COVID. And it's so funny, Patricia, because both women worked together like this, and we were all in the trenches for weeks, for months actually, while we were working on my campaign. And then I got the call that she was in the hospital, and they both contracted COVID together because they were, I guess it was 3 people in a car.
Oh.
And none of them were vaccinated. And the 2 people with pre-existing conditions contracted COVID, and we lost both of them.
That's amazing.
Yeah, we lost both of them.
Sorry for that.
So what do you say to people, Patricia, who are saying, well, they're not going to get the vaccine? Like, what are your thoughts?
My thoughts on that, it's why aren't you getting the vaccine? Because as we see that this COVID-19 does mutate, and one of the reasons it is mutating, because not everyone is getting vaccinated. So it goes on and starts to recreate itself. And each one could be even more deadly than the first one. So I'm on board with vaccination, and I'm on board with boosters, because it's helping your family, it's helping yourself, it's helping your community. So why not get it? And I know that everyone has their reason as to why they're not getting it, but think outside of that. Think outside and look around and see children. Children are getting COVID. You want children to have a future. You want a future, and a future for your own family. So I'm not understanding fully why some people are not getting vaccinated.
Yeah. For me, when I first heard about the vaccine, I have to tell you, for like a brief moment, I was hesitant.
Oh, yeah.
Even though I do public health work, and even though part of my job is to tell people about getting the vaccines, for a brief moment, I was hesitant. But then after speaking to the experts, I decided, and then the fact that I'm always out, I'm always in the community, right? That's part of my job. I'm required to be interacting with the community. So I decided, for me, you know what, let's do it. And I'm happy that I did, because it brought me a level of comfort and peace of mind.
That's it.
It brought me, I'm diabetic. And my father is diabetic, and he's, has had a heart attack and multiple heart surgeries in the past. And I want to spend time with him. I like going over to his house to eat his chicken soup. I like going over there for my food because he can cook really well. And that's not the only reason why I go visit my father, but it's certainly an incentive.
Yes.
And without being vaccinated, I don't think either of us would be comfortable with me spending time with him.
Right, exactly. And my mother, she's 91 now. She's also vaccinated, and she also got her booster this past Sunday at Holy Family Church. And she is happy. It's not like she's saying, well, I'm 91, why not get the vaccine? No, she's a fighter, and she's saying, I'm going to get the vaccine because I want to see my grandchildren. And I want to have my daughter come over and be comfortable. And I go over there almost every day. And so she took the vaccine. She's 91. And she knows the importance of that. So I look to her as a role model also.
Oh, that is so beautiful to have your matriarch of your family still around. I miss my grandmother a lot. Yeah, I miss her a lot. So how were you processing the grief and the loss of your aunt?
That's a great question. We some days process it fine, and then other days not so fine. Just my mother, she received a Christmas card, just for an example of how she's dealing with it. And the Christmas card, it brought her tears because she said, my sister, she's missing out on all of this that's going on. And so, but we know that there's stages of grief, and the last one is acceptance. And maybe you are in one stage for many weeks, months, years even. Maybe you won't even get to one of those stages, but we know that it takes time to cope with the grief. Takes time.
It does. And it takes time for me. I mean, when I lost my son, I think I was perhaps stuck in anger for like 2 years.
Yes.
So that's such a powerful point that you made, that sometimes, we all kind of travel through it.
Right.
At our own pace. And it's not linear, right? Because you can go from one and then back to the other, like with a drop of a hand. And then with your aunt, she loved Christmas, as you said. So I can just imagine how challenging this is for your family right now.
Very challenging. And for her remaining sisters also. And I have 2 sisters, and I can't imagine losing one of them. So I don't know exactly what she's going through and what they're going through, but I know it's tough. And they might still be in that stage of anger too.
Yeah, I can imagine. And so how is your family dealing with vaccines? Are people now eager? Is everybody vaccinated? What's the thought process of some of your family members around the vaccine and the booster?
All families have some people who are not on board to get the vaccine, but I will say most of my family, we just had Thanksgiving together, and I would say almost everyone there was vaccinated. And I was like, what am I going to hear anything after Thanksgiving? But we haven't heard anything that anyone has gotten sick or anything like that. But like I said, I have 2 sisters, one who's fully on board, and then the other one, she's still thinking about it. And so I have to accept that from her because I love her so much. But we still talk about it. We still want her to get the vaccine. And with the variances that are going out there, please get it. Get the vaccine. Protect yourself. And it protects you. They're studying it every day to see that it protects all these variances that are out there.
Yeah, it's challenging. I understand exactly what you mean when you say that you have a sister that's hesitant and that you're loving her through it, right? I have somebody whom I fully love and respect. One of my best friends. I have known him since my 20s, right? Like he's the one that I would call when my back is up against the wall. And as a college student, when you're like down to your last Roman noodle in the fridge, like he would be the friend that I would call. And he got COVID, and he would prefer to get the Regeneron. Is that the medication? The medication that they say now is FDA approved to treatment. Like he's more comfortable getting that than the vaccine, and I don't get it. And our views are so different on this issue. But I've decided that it's an unconditional love, right? And you pray
Yes.
and you hope, and you are like, okay, God, I don't want this to be one of those stories where somebody's not vaccinated and refuse to get vaccinated and then they pass away of COVID. Because you hear those stories.
Yes, definitely. We hear those stories all the time. We hear those stories, even the ones that are famous and they put out there on the social media, please, I don't think this vaccine is so great and so on. And then they contract COVID and they pass away. I don't know. I hope their followers will look at that and see, wow, maybe I should look into getting this because he passed away. And then there are others who won't even believe that he passed away or she passed away from COVID.
Yeah.
But I hope
And
it changes minds.
the other thing too is that there are quite a few people who, well, I'm saying that they're like, three different camps, right? You have the person who contracts COVID and they don't have a really severe impact, so they don't necessarily need to be hospitalized. You have the people who are hospitalized and it really affects them. Some people pass away, and then others really can suffer long-term effects from COVID. And that's what I think scientists are studying right now is once you contract COVID, like what's the long-term prognosis for you? How is that really affecting your lung and your different body functions? I mean, I'm not a clinician. You perhaps understand the clinical implications better than I do, but that's something to be considered too, don't you think?
Yes, I definitely think so because I have also a friend who it's just this constant cough and she had COVID and it's been months, but she still has a cough. There, you can also have blindness or loss of vision. And it just, the list goes on and on as to what COVID can do to your body. Children, they affects their feet or their toes, and they have something called COVID toes. So why not go ahead and try to prevent these types of things in your life? The life is already by itself busy, crazy, exhausting, stressful. If you can get one stress off of your plate by taking a vaccine for COVID, you take a vaccine, so many other vaccines, why not take it? Go ahead and do it.
Wow, I did not know that one of the long-term effects could be blindness or this thing called COVID feet. Wow, you just taught me something new, Patricia. Thank you for that. So this is National Influenza Vaccination Week. And so we're encouraging people to not only get their vaccine for COVID, but also the flu shot. And now is flu season, right? So it's really important for folks to protect themselves from the flu as well.
Yes, yes. I get my flu vaccine. I know some people complain that it will have you have symptoms of a cold, which is fine. And that does happen. You may have a fever for 24 hours or so, but then you get over it and then you're protected against having full blown flu that you could end up in the hospital also and pass away from lung disease or you can't breathe. So why not protect yourself also? I say go for it.
Yeah, me too. I mean, dude, the thing that I do not want in this season is to have influenza, to have the flu, like a severe case of the flu and COVID. Because can you imagine that on top of me being diabetic? No, sir.
Mm-mm. No, sir.
No, sir. Not at all. Not at all. I like, I will take the vaccine. And I haven't had my flu shot yet. I'm going to get it. I have had my 2 doses of the Pfizer, and I had the booster the other day.
Oh, awesome.
And I have to say that I actually had a reaction to the booster. I
Yeah.
felt, I really kind of felt like I had, like how people say they feel when they have COVID. But after like 5 or 6 days, I was fine. And now I feel confident when I'm out at an outdoor event. And, the CDC says that when you're outdoors, it's okay to not wear a mask. But it used to make me nervous, even being outdoors without a mask. So now that I'm fully vaccinated, I feel like I can breathe easier,
Definitely. I agree with that. And even though I'm outside, sometimes I'll still wear my mask also. And I'm fully vaccinated, as you say, and will be getting the booster and the flu shot. But I still take that precaution of wearing a mask.
Yeah, I get it. I totally get it. Well, so this week is National Influenza Vaccination Week, and at Live Healthy Miami Gardens, we have a plethora of opportunities for the community to get vaccinated for COVID as well as for the flu shot. And there's a couple of activities coming up. We'll share that flyer with you right now. So the National Influenza Vaccination Week, it kicked off yesterday, which was December 6th. And we have a series of activities that's happening throughout the community. So today we're having this conversation with Patricia around her COVID story. And then tomorrow, which is Wednesday, December 8th, you can go to CFCE, which is the Center for Family and Child Enrichment. And they're giving flu shots as well as a COVID vaccine. And then we'll be back on our Live Healthy Miami Gardens wellness webinar at 12 o'clock, where we really are going to be having perhaps a grief counselor on to really talk about processing grief and how do you navigate this time with COVID-19 and the flu season being together. So that's Thursday at 12 o'clock. You can go to livehealthymiamigardens.com to register for that. And then on Friday, you can go to UHI to get your COVID vaccine as well as your flu shot. Now, on Sunday, we are hosting an interfaith candlelight vigil at Betty T. Ferguson from 5:30 p.m. to 7:30 p.m. And this is really a time for the community to come together. We have over 9 faith-based communities, over 9 churches and mosques coming together to pray for our community, to pray for strength and endurance and perseverance as we navigate year 2 of the COVID pandemic and as we enter into another flu season. And we'll also hear stories from folks who have either suffered from COVID and or lost family members. And this is really a time, Patricia, where the community, the entire community can come together as a body and comfort each other and encourage each other. And, Miami Gardens is a community of faith. So I'm going to say it, pray together, right? And so it's an interfaith candlelight vigil on Sunday, 5:30 at Betty T. Ferguson. And I hope to see you there, Patricia. So we're asking everybody to come at 5:30. We do have on this flyer 4 pastors shown, but in addition to Holy Family Episcopal Church and Greater Love Full Gospel Baptist Church, we have Greater New Bethel Baptist Church, we have Breakthrough Interdenominational Christian Center, Love Fellowship Ministries, Trinity Church, the Islamic Center of Greater Miami, Bread of Life Community Church, and Antioch Missionary Baptist Church. We're all 9 of those faith-based organizations are coming together to honor those and to remember those who have been impacted by COVID-19 and the flu, because people die from the flu as well. So, Patricia, I hope you'll be able to join us on Sunday. I look forward to seeing you there.
Yes. I hope so too. I will be there. Definitely. I will be there.
So,
thank you so much.
I think when we talked about putting together this candlelight visual, it really is our intention to create a space where the community can come together. I don't think we've had that yet, right? Like one gathering place where we can come together as a community and mourn, or in some cases celebrate, because a lot of people have had COVID and they've gotten over it.
Yes. And Betty T. Ferguson, that is an awesome place to do that because it's so centered and we can all gather there and it's a great space. And I agree. Let's get together and let's talk about it. Let's share our stories and encourage each other, because the best way to get over and to cope over grief is to think positive is the first. Pray, as you say. And right now, our church, we're in the Episcopal season. We're in the Advent season, and it's joy, hope, love, peace. So it's a perfect time for us all to get together. Just perfect.
Yeah, I like that. The Advent season, hope, joy, and peace. That's so true, Patricia. Do you have any, advice for someone who may currently be going through the possibility of having a loved one transition from this horrible disease?
The first thing I would say is, if you're a person of faith, is to go to that person, hold their hand and say, hey, let's pray together and let's do this together and talk about it. Talk about your feelings. Talk about what in the past and also have fun. Talk about funny things that has happened, but also think positive and to also have a good moral faith in yourself and to talk to that person and say, tell me what's going on. How are you feeling? The first thing you can do is communicate.
I like that. Communicate. That's so true. And, a lot of times I think we don't really talk about our feelings. We sometimes bottle it up inside and push it down, and we keep ourselves busy so we don't have to think, and we sometimes even numb our feelings.
Right. Because I'm sorry to hear that you have a son that passed away, and I had a niece who passed away. She was 18 years old and she got hit by a car, and we're still kind of processing that one, because that one happened in 2008 and I was close to her. She was like a daughter to me. So we just have to tell our feelings. And then her mom is my sister, obviously, and her mom needs to talk about it. We went to grief share counseling, and that helped a lot. It really did. So if someone can find a grief counselor, a grief program, even if it's for 2 or 3 weeks, go ahead and do it, because it really helps you to process your loss.
So true. And if you're in need of resources around mental health or grief, please go to livehealthymiamigardens.com. We have resources there, lists of local providers that you can reach out to for support. I know CFCE has a mental health component, as well as Jesse Trice and a lot of other providers. So there's no need for you to suffer alone. There's help, whether from your church or from a local health provider. Please do seek some support.
I definitely agree. It will help you.
Yeah. Well, thank you so much, Patricia. Thank you for coming on and sharing your story. I really appreciate you.
Oh, thank you, Melissa. Thank you for having me. I appreciate it.
All right. Fantastic. All right. You too. All right, family, please do keep an eye out. This week is National Influenza Vaccination Week. There are plenty of opportunities for you to get your flu shots and your COVID vaccine for free in the city of Miami Gardens. We're going to leave you right now with a video that highlights some of the activities that's happening this week. Most important of all, I want to remind you to come to Betty T. Ferguson at 5:30 p.m. this Sunday and join over 9 faith-based organizations in the city of Miami Gardens as we remember and honor those who have been impacted by COVID-19 or the flu. And of course, celebrate those who have survived. We're in this thing together, family. See you on Sunday.